Smith, the Regional Group of Independents Deputy Matt Shanahan, the Rural Independent Group Deputy Michael Collins, and the Independent Group Deputy Michael McNamara. So good luck to them in their endeavours. We move now to item number 9 on the agenda, which is a statement by the Minister for Health, and questions and answers then to the Minister. Minister, the floor is yours and you have 10 minutes for your initial statement. Thank you.
Thank you very much, Ken Corlon. I very much welcome this opportunity to once again update Dáil on the COVID-19 disease and our national response to it. Let me start by expressing my condolences to the family and friends of those who have been lost to this awful disease since I was last in this House. This is an individual loss. It's also, though, a sense of national loss. We all share in your loss. Today I want to first update the House in 2 ways: by providing the latest information I have on our ongoing modelling work, and by sharing some key messages from my discussions with the Chief Medical Officer, Dr. Tony Hoolan, today. Ciancórla, colleagues will recall that the R0, or the reproduction rate, was previously in a range of 0.5 to 0.8. I am advised that that range is now as low as 0.3 to 0.8 in some estimates, and that the overall rate is now considered stable at around 0.5. The other data coming through in the modelling is the number of admissions to hospital and to intensive care units. I'm pleased to inform the House that both of these have halved in the last week. Last week, hospital admissions were around 40 a day, whereas this week, I'm told by the modelling that it's around 20 a day. And last week, ICU admissions were around 4 to 6 a day, whereas again, the modelling now tells me it's around 2 a day this week. In long-term residential care settings, the number of cases is declining now, based on preliminary data, from about 100 new cases a day in early April to around 50 a day towards the end of last week. These significant decreases are welcome signs of progress, and they are the tangible results of so much hard work across our health service and indeed across all of our country. I want to say a genuine thank you to everyone working so hard. As I said earlier, I want to now share with you 4 key messages from my discussions today with the Chief Medical Officer based on the stage we're now at as a country. Firstly, as the public health measures in our society begin to be lifted, our personal behaviours will become more important than ever to protect ourselves and to protect each other. If we continue to wash our hands, practice coughing and sneezing etiquette, and maintain social distancing, we can move more safely to our next phase when the 18th of May comes about. Secondly, the levels of disease in our community continue to decrease. This now gives us an opportunity to go after this disease where it is and to focus our attention on places that are at higher risk of outbreaks, such as workplaces and other congregated settings. Thirdly, the World Health Organization has said that this disease may be with us for a long time to come. It will be with us either as low levels of transmission or as waves of higher infection rates. In order to be prepared for this, we must as individuals continue to remain vigilant and as a society be ready to reintroduce public health measures when necessary. Fourthly, as a country we have pushed back this disease through working together and protecting ourselves and protecting each other. As we continue to do this in the future, we continue to be stronger than this disease. The sacrifices that we have made, the work that we have done, and the solidarity that we have kept have pushed back this disease enough so that we're now able to begin to tentatively plan for a reopening of our society and our economy. But let me be very clear, this progress is fragile, and this plan depends on all of us remaining resolute and relentless in our national effort to suppress this virus. Our roadmap is published, and we're working to move forward with it, but we do so with all due caution. The protection of the health and lives of our citizens will continue to be our primary concern. When we come to consider any further easing of restrictions, we will continue to rely on our expert public health advice, and we will have regard to the latest data on the progression of the disease, the capacity and resilience of our health service in terms of hospital and ICU occupancy, the capacity of our sampling, testing and contact tracing programme, our ability to protect and care for those most at risk from the disease, and also importantly, an assessment of the risk of secondary morbidity and mortality as a consequence of the restrictions. We will make our decisions based on this advice and data, along with considerations as what's best to do for our society as a whole. We have pushed back this disease collectively, but it has certainly not gone away. It can return with ferocity if we do not remain vigilant and retain our ability to be flexible and agile in our response. We will not risk losing the ground that we have gained against this disease. The people would not wish us to. All of our decisions will continue to respect the hardship and the sacrifice that so many have made to bring us to this point. As I already mentioned, a critical element is our ability to test and contact trace so that we can limit the impact of future outbreaks of COVID-19. Our target testing capacity remains as advised by the National Public Health Emergency Team on the 17th of April. The ability to do 100,000 tests per week, operating on a 7-day-week basis for a minimum of 6 months. The HSE has developed a plan for building its capacity towards that target, and I'm pleased to say it is now delivering real results. Significant progress on building and increasing testing capacity has been made in what objectively must be seen as a short space of time. The result is that capacity has now expanded to 12,000 a day, and turnaround times have significantly improved. The HSE is now stepping up capacity to 15,000 tests a day in the next 2 weeks. Turnaround times will continue to improve, and we should see average turnaround time from swab to result of 1 to 3 days by the 18th of May. We're continuing, and this is important and welcomed, I know, by our GPs and by health professionals, to widen the net of groups being tested to meet this capacity. Now that we have extra capacity, we're widening the criteria in terms of who can be tested, and this is good as we continue to aggressively go after this virus where it's most likely and also where it will do most harm. So we will continue to strategically target testing to vulnerable groups. And those testing priorities will be decided, let me be very clear, by public health experts and by the National Public Health Emergency Team, and they won't be political decisions. We'll target that testing where it can do most good in terms of going after the virus where you're most likely to find it and in groups in which it's most likely to do harm. The behaviour of this disease in our residential facilities continues to be our area of greatest concern, despite what I think people would have to acknowledge is a significant improvement based on the modelling data in terms of the reduction in the number of new cases. Our 23 response teams across the country, led by senior nursing support, will continue to provide senior clinical expertise, infection prevention and control and public health input to prevent and manage clusters in nursing homes and other residential facilities. And when we get into, no doubt, the questions and the answers, we'll have an opportunity, I think, to outline some of the benefit we're now seeing from the home help agreement in terms of the redeployment of staff from that sector into our nursing homes as well, which has begun in earnest this week. We have, as you know, prioritised testing in our long-term residential care setting. I think that has yielded a real benefit in terms of getting on top of this virus. And our regulator, crucially, the voice that we, the Oireachtas, put in place to oversee safety in nursing homes, HIQA, will have ongoing oversight of the response of these facilities through its COVID-19 Quality Assurance Regulatory Framework, and its visits to nursing homes started at a very good meeting with HIQA yesterday on that as well. Last Tuesday, we were able to increase the distance which people may be able to go to exercise to up to 5 kilometres. And we could also provide advice to those who are cocooning on how they can safely take some exercise, as long as they do take those necessary precautions in the interest of their own health. I do want today to say a special word to people in this cocooning category. I know this is an uninvited label, and it's a very much unloved label as well. I'm actually not sure where the word came from, but I don't think I've yet to meet anyone, including myself, who likes it. People who are well aware that they have an increased vulnerability to this awful virus, but they do not associate their ordinary non-COVID lives with vulnerability. You know, people in their 70s and 80s in good health. Following the advice on how best to stay safe contrasts starkly with a life lived normally, actively, resiliently. And I do hope the increased activity suggested by the recent advice helps, and we want to build on that. We'll continue to honestly provide the advice on the best way for those most adversely affected by the virus to stay safe. So we don't do it to in any way cause offence, we do it in order to impart the best possible medical advice. And I hope as we further together suppress this virus, we can get closer to those normal lives as quickly as possible. We were able to bring in these changes, and we were able to begin to tentatively plan for the reopening of our society and some of our economy, because our country has acted as one in doing what it takes to suppress this disease. We can continue to move forward safely and look forward to better days if we stay the course and remain vigilant. I want to conclude by expressing my gratitude for the continued unity of this House in supporting the public health advice, whilst rightly scrutinising the government response. And I very much welcome the establishment of a new Oireachtas committee, which I know is set up to aid that effort. On that note, I have to ask all of us to stress the difference we can all still make between now and May the 18th in really weakening this virus as much as we possibly can. And we now know how to do it as a country. Wash your hands, cough and sneeze properly, keep your distance, stay at home, stay safe, mind each other, protect each other. That's how we're going to make sure these days between now and the 18th of May really count. Because the weaker we can make this virus during this time, the greater chance it gives our national plan of success, that we can press go and proceed with trying to get back to some degree of normality. And the greater the opportunity will be to save lives and keep people well. And I know that's what we're all about.
Thank you very much, Minister. Now, Deputy Stephen Donnelly, sharing with your colleagues, Deputy Butler and Deputy Cal.
That's right. Thank you, Nicola. And with your permission, we might do as we did last week and just take the first 6 minutes with the Minister, myself, and then my colleagues would like to go back and forth if they could. And Ken Corla, I too would like to start by expressing my deepest condolences to the friends and families of the many women and men who tragically have lost their lives just since we met here last Thursday. Minister, to that point, I'd like to talk to you about cancer services. The HSE told us yesterday that GP referrals to the rapid access clinics for patients with suspected cancers have fallen by more than a half since COVID-19 arrived. And that means that a lot of people with cancers are going to have those cancers missed, at least in the short term, and we know that matters greatly. The HSE have said that far less people are going to their GPs with their suspected concerns. They've said some people may not be aware that the full GP services are open, and we all know that other people simply are afraid to go out still. They're very cautious about catching this awful virus. Minister, the UK study, which I'm sure you're aware of in the last few days, shows that they have an even bigger fall in access from GPs to their rapid access clinics. But worryingly, it also predicts that in England alone, they could see a 20% increase in cancer deaths just in the next 12 months because of this lower number of referrals. So, Minister, if that were to happen here, please God it won't, but if that were to happen here, we'd be looking at around an extra 2,000 deaths from cancer in the next 12 months alone. So, in short, if we don't fix this and if we don't get these referral rates back up, we could end up with a situation where more additional people have died from cancer than actually die from COVID-19. On top of this, as you know, the screening services have been suspended for reasons that we all understand. And on top of this, the oncologists are saying that a lot of the services they use, diagnostics, operating theatres, while available, are much slower to access than they normally would be. So my 3 questions, Minister, are as follows. Isn't it now time to reopen the screening services and to get the diagnostics and identification going again? Isn't it time, would you agree, that we should launch a major national campaign, a public education campaign, with the same level of focus and professionalism that has been done with COVID-19 to get people back to their GPs if they have concerns? And finally, can I ask, what can be done to address the very serious blockages that are still in the system for oncologists as they try and get their patients diagnosed and treated as quickly as possible? Thank you.
Minister.
What is a massively important issue. I mean, you're right, it's entirely possible that this country, and indeed many others, come through the COVID pandemic, absolutely with tragedy and pain and hurt. Of that there's no doubt, but actually that we could see more people pass away or get very sick from other illnesses and secondary morbidity and secondary mortality, and we need to work collectively against that. And as a result of the huge efforts of the Irish people, we haven't seen, thankfully, our hospitals, as of now, overwhelmed in the way they could have been. We haven't seen, as of now, our ICUs overwhelmed in the way that they could have been. That doesn't take away from the personal tragedies. And we also, as you know and have been engaging with me on, we also have some capacity now in private hospitals as well. So we absolutely need to now have non-COVID care running alongside COVID care. And at the National Public Health Emergency Team meeting on Tuesday of this week, they lifted, let's say, the largely blanket ban on many procedures. And I'm not talking just about cancer, but non-COVID care procedures, and have now changed that to the basis of a clinical and operational assessment. So now the HSE have gone off to, I suppose, finalise their non-COVID care plans. But specifically in relation to your questions on cancer, I think the first message we have to get out in this House is that GP services are open, they're safe, and they want to see their patients. And one of the things GPs have led on is the establishment of our community assessment hubs. And this is basically a pathway for care for people with COVID in the community to keep general practice COVID-free. So that's a further reassurance tool, I think, that they're providing, and very welcome. The second thing is, today, the National Cancer Control Programme has done exactly as you suggested, and has actually started a major public awareness campaign, and I'd welcome your input on how we can make this as good as possible. to tell people not to delay, not to ignore a symptom, to pick up the phone, to use our cancer services, that they're absolutely, that they're there. In relation to the reopening of screening, that is going to be a clinical decision taken by the National Cancer Control Programme in consultation with NEFIT. I'd like to see it up and running as quickly as possible, but I'm conscious that it needs to be done in a safe way and at an appropriate time as well. I don't want to use up your time, but there are a number of issues under consideration and being worked through between the Department, the HSE and the National Cancer Control Programme, including medical oncology services continuing with the relocation of day wards where necessary, radiation oncology services continuing with provisions made for physical distancing, maintaining urgent surgical oncology services as a priority, with many of those services now relocating to the private hospitals. So yes, cancer care is absolutely a priority, as is getting non-COVID care running alongside COVID care. I think a lot of good work has been undertaken by our healthcare professionals in that.
Okay, we've 30 seconds I have. Thanks. Minister, thank you for that. Look, it is good that the National Cancer Control Programme is doing this, and obviously we heard them on the radio this morning. What I'm proposing is something far more ambitious, though, because huge resource and professionalism and talent and money has been brought to the public communications around COVID-19. There are adverts in every newspaper, there's adverts in every radio programme, there's adverts on the television. We're all out talking about it. Every door you open has a big yellow sign on it. Now, and that is fantastic and deserves great work. What I'm saying is that with the best will in the world, the National Cancer Programme, the Control Programme on its own, could never replicate that. And if what we're looking at is potentially more people dying of an additional cancer rate than potentially die from COVID, can we deploy the full resources of government as have been deployed for COVID-19 to this? Thank you.
And maybe the Minister can try and include that in its response.
Minister, once again I would like to speak about nursing and care homes, and I acknowledge in your opening address how you spoke about the number of cases is declining based on the preliminary data from about 100 a day in early April to around 50 a day towards the end of last week. And I want to pay tribute and thank all the fantastic staff in all the nursing and care homes throughout the country for the work they have done over the past 2 months. They have gone far and beyond the call of duty. Minister, on Tuesday last, I visited St Cartridge's in Lismore, a care home for 42 residents. It's a fantastic facility for low to moderate dependencies. And the reason why I called there, I was delivering hand sanitizer supplied by Irish distillers and distributed through Irish Rural Link. Unfortunately, couriers were unable to deliver due to the alcohol content, so I took on the delivery for the Waterford area. Delivering the hand sanitizer outside the premises, observing social distancing, I commented that the staff were in terrific form, and they told me that all 42 residents and staff had been tested. Results had come back and all were COVID-free, every single one of them. Minister, the worry, the concern for residents and staff had been ongoing for weeks since the pandemic started. And it is the same in all facilities. And I believe there should be regular testing of staff and residents of nursing and care homes across the country, maybe on a monthly or a bi-monthly basis. The pandemic has borne down heaviest on older people, and in particular those in nursing homes and residential facilities. Latest figures indicate that some 740 nursing home residents have passed away after contracting the coronavirus, and that's more than half of all the confirmed deaths. I know testing has been ramped up in nursing homes in recent weeks, and I understand that more than 90% of them have now been tested. This is welcome, but I think is an exercise that should be repeated on a consistent basis. So, Minister, what I'm asking for, do you agree that there should be testing on a consistent basis, maybe on a monthly, bi-monthly, and hopefully it could be done in-house? Because when you see the joy on their faces that they were all COVID-free, it was a joy to behold.
We'll take Deputy Cahill as well, because then the Minister can maybe combine his answers.
Okay, thank you, Concord. And I suppose at the outset I want to sympathise with all the families who have lost loved ones from this virus. Minister, can I raise with you the concerns about St Bridget's Hospital in Carrigan-Shore? I've been contacted about the hospital by local councillor Kieran Burke and some of the staff at the hospital. St Bridget's is a hospital of the highest reputation and standards within the system. The hospital acts as a step-down facility from acute care for the South Tipperary and South Kilkenny area. In the current crisis, it was appointed as a facility for a step-down facility for COVID-19 patients who had left acute care. We've been informed 2 weeks ago that the demand for such COVID-19 step-down beds at St Bridget's Hospital had reduced, and the hospital had been temporarily suspended. Admissions for step-down COVID-19 rated care at St Bridget's Hospital would resume when required. However, it is now believed that beds are physically being removed from St Bridget's to Our Ladies in Cashel. Minister, will you ask the HSE to make it clear that there is no threat to the future of St Bridget's, and when the COVID-19 crisis has ended, it will return in full to its previous service within the community?
Back to you, please.
Thank you, Deputy Donnelly, Deputy Butler, Deputy Call. Just Deputy Donnelly, just to conclude our conversation in relation to cancer care, and in fairness, I know you said this also, but it need not be the way. It need not go the way that it potentially will go in other countries because of the efforts that the people have put in this country and the leadership that our healthcare professionals have shown. We now have an opportunity to really ramp up our non-COVID care plans alongside our COVID care plans. And I want to assure you of my department and the HSE's real appetite for doing that. So I don't want our public to be unnecessarily concerned. The health service is open. The health service has capacity available, not something a health minister is usually able to say, spare capacity in our health service. Our GPs urging people to call them, community assessment hubs in place. Irish Cancer Society, Cancer Care West and others have all come together to really ramp up their services and their supports. I want to acknowledge and thank that. And a major advertising campaign will start next week. But I very much hear the Deputy. It needs to be a significant and very visible one. And I give my word to you on that, that we will ensure that is the case. And I'll revert back to you in relation to what that might look like. Deputy Butler, thanks for telling me in relation to your visit to St Cartridge's and for the work you've been doing there to help in relation to the hand sanitisers. I think the experience you've articulated is one that I've seen as well across the country when I engage with nursing home owners and at my twice-weekly meeting with nursing home owners as well. It is that sense of relief, that reassurance that a negative result can provide. And thankfully, we've seen with the positivity rate of our testing overall, I'm not just talking about nursing homes, we've seen a positivity rate drop back to about 3.7%, I think it was last week. So the overwhelming majority of people are getting that peace of mind that this is not COVID. But you're also right, testing is only, it's only a point in time. You need to keep going back and you need to do it again and again. So yes is the short answer. There will be a recurring programme of testing for long-term residential care facilities. NEFIT is due to consider a paper on how best to do that, either at its meeting on Friday, which is tomorrow, or Tuesday of next week. But in the next week, we'll be finalising that. We'll also be talking to the nursing home sector, to HICWA and to others about how the lessons can be learnt in relation to streamlining this. And you're entirely right as well. There's a real appetite from nursing home staff, nurses particularly, to do the testing themselves, which would greatly assist everybody. So we're going to take them up on that, but we need to work out a way to do that most appropriately as well. Deputy Cahill, in relation to St Bridget's, in Carrick, I'll certainly take your concerns directly to the HSE in relation to seeking clarity on the intended use and the restoration of that back to its former purpose post the pandemic, and I'll revert directly to you on that either today or tomorrow.
Donnelly, with some time remaining.
Thank you. Yes, that would be great. Thank you for that, Minister, and I appreciate you're looking into a very major campaign. Could I ask as well, the oncologists are frustrated. Everybody understands why the blockages have appeared in the system as they have, but there would appear to be a disconnect between the public narrative, which is services are open, cancer care services are operating as normal, and what the oncologists, and I guess more importantly, their patients are experiencing, because there are an awful lot of blockages, there are an awful lot of delays. So if you could look at that as well, it would be fantastic. Minister, while we have the time as well, on the turnaround time for the testing for the nursing homes, it's great that NEFIT is looking at a paper for retesting. The turnaround time in the hospital settings is 24 hours, more or less. If a patient or member of staff is treated, they have the result within 24 hours. In the nursing homes at the moment, it's regularly 5 or 6 days, and sometimes it's more than a week. I raised this directly with the HSE yesterday, and what they said was their target was to bring it down to 3 days by mid this month. Can I put it to you that the target should be 1 day? The target for the acutes is 1 day, so that if you have an outbreak, you can identify it, you can isolate, you can contact trace, and you don't have this big knock-on effect on patients and on staff. I would suggest the nursing homes have exactly the same need. One of the reasons the HSE gave was the ambulance crews need to go out. Obviously, the nursing homes have trained clinical staff. They can take the swabs themselves. So could I ask, would you push the HSE and maybe put it to NEFIT that the target should not be 3 days for the nursing homes? It should be the same as the acutes at 24 hours. Thank you.
Minister.
I will indeed, and I think you've hit the nail on the head. If we, as Deputy Butler also said, if we can get to a point where nursing homes are in a position to use their own staff, which, by the way, I know the staff are willing and up for that, that obviously further removes a potential delay in terms of having to wait for it. The National Ambulance Service have been incredible. They've done an amazing job. But if you can actually take out that piece and in-house do the testing, that will further speed it up. But yes, I will. I mean, the HSE's own testing targets does have a situation where there'll be an average wait from swab to result of 1 to 2 days from the week beginning the 18th of May.
You're sharing with colleagues, are you?
Sharing with Dr. O'Muraku and Dr. Andrew, 7, 4 and 4. So, Minister, if you will, I'll take 4 and 3, if that's okay. And the lads can look after their own time then. So, Minister, the first issue I want to discuss with you is that of nursing homes. So 2 weeks ago, I was advised on a teleconference with the HSE that patients were not transferred to nursing homes unless they had had 2 negative tests for COVID. Now, some of this is anecdotal information that's coming to me. Some of it I have through a member of my own family. And the very firm belief is that at the very start of this, in preparation for the surge, that patients were moved without being tested into the nursing home sector. And the belief in the nursing home sector among some staff members, and indeed, as I have said, among members of my own family, is that the virus was brought into the nursing homes from the hospital. I have raised this with you previously, Minister, but can you confirm that the testing is now being done in every single case? And can you also advise if it is your intention to examine the possibility, as raised by me previously, that this virus may have come into the nursing homes by dint of the preparations that were made at the very, very beginning when people were moved out? I'd be straight with you, Minister, I'm not convinced that that testing happened. I understand that's what the HSE had said to me on the conference call, and I believe that it may be practiced in some instances now, but I don't think it was practiced at the time, and I do think that there is an issue there that needs to be examined. The next issue I want to raise with you is on direct provision. I want to thank the members of Fingal Communities Against Racism for the good work that they continue to do with our neighbours in Balsaskin. Yesterday, I asked the HSE how many COVID-19 positive tests had been found in direct provision. I was told that the number was 150. Later on, at a briefing with journalists, they were told that the number is 88. Okay, so I understand this is an ongoing situation, but you might give us the exact figure. I've been contacted by a woman who was moved out of her centre to a hotel to self-isolate. She was told that it would be helpful because she'd be nearer to a hospital, that she could quarantine for 7 days. She has 3 small children and they are all in one room. She and one of her children have serious respiratory conditions. She's worried that people who are self-isolating because of suspected cases are also being housed in the same location, in the same hotel. This is contrary to HSE advice. She is terrified, Minister. She has requested a transfer, as anyone would. Now, they're telling her that the transfer requests can't be processed due to COVID-19. Minister, the transfer process has to be it has to be processed because of COVID-19. That's what makes it urgent. She's been left in one room with 3 kids, living on noodles and bread because that's all that she can get. She doesn't want to go back to Balsaskin, where there were 93 cases, representing an infection rate of about 40%. She wants to protect her kids and she needs help. So, Minister, can I ask, how many positive cases of COVID-19 are there in direct provision? Can you, as a matter of urgency, ensure that the additional capacity created in places like City West can be utilised by people in DP? Can you ensure that the process of mixing those who are cocooning with those who are transferred out of DP because they are suspected cases will stop immediately? And can you urge the Department of Justice to facilitate transfers for health and safety reasons? And Minister, I also want to raise with you just one more time the issue of geriatricians being part of the teams that go into nursing homes. I did raise this with you last week. It is something that I didn't receive anything, Minister. If you did, I apologise for not saying it. But I think it would be a really good idea. I think it would be very, very beneficial. And Minister, before I finish, I want to raise one more issue. Section 39 agencies and charities have been struggling for some time due to loss of income through funding cuts over the past decade. I want to ask you if you will look into establishing a COVID-19 fund for these charities to help them get over the difficulties that they face currently, and if you will restore the €20 million funding cut to Section 39 agencies and guarantee the HSE funding to the sector. Their normal channels of fundraising, as you can appreciate, are pretty much closed to them at this moment. They are very desperate, they do need help, and they are providing vital supports in the community.
Thank Deputy O'Reilly for her questions. Try to get through them. On the Section 39s, certainly take a look at that and come back to you. On the geriatrician point, if it hasn't gone, I've written you a letter on it. And I think the short answer is yes, we're looking at trying to do something not too dissimilar to what you're suggesting. In relation to nursing homes, look, the National Public Health Emergency Team is going to take a look, and I've discussed this with the Chief Medical Officer, at the whole area of long-term residential care in nursing homes, because there is, as you rightly say, a lot of anecdotes there. For example, we saw one about the visitor restrictions, and in fairness, I think the data and the graphs that have been produced by NEF and the Chief Medical Officer show that the timelines don't align. My gut is it's similar in relation to delayed transfers of care and people being discharged into the nursing home sector. But yes, the short answer is we're going to examine that and revert. It does seem that community transmission is the most likely of people. Obviously, essential care workers doing an incredible job, but having to come into healthcare facilities seems obviously to have had a factor. So we will be doing that paper in relation to that, and of course we'll be sharing that with these houses and with the committee, and indeed whatever other appropriate, we'll publish it as well. In relation to direct provision, I just want to say, firstly, if you don't mind me saying so, because I think it's really important we acknowledge this for those who sometimes like to talk down the many brilliant people who come to our country from other jurisdictions. There are 160 healthcare workers resident in direct provision centres across the country. So when we're applauding and thanking healthcare staff, we should be cognizant of the fact that 160 healthcare workers are actually coming through direct provision. So I want to thank them for the contribution that they're making to the Irish Health Service. That may be a different issue, Deputy Shortall, but I want to thank that because there's a lot of other individuals, I've already acknowledged that, there's a lot of other individuals who, a lot of things I don't like seeing around the country when it comes to not extending a Céad Míle Fáilte to people from other jurisdictions. I want to thank them in that regard. My own figures, and I need to be clear on this, Deputy O'Reilly, because I prefer when figures are given out by the HPSC, just in terms of accuracy, but the figures that I have is that there have been 164 confirmed cases of residents in direct provision. That's the figure that I have. I'm happy to share that with you. A range of measures are in place to address any case of COVID-19 if or where it arises. This includes the provision for self-isolation facilities and centres. I had a meeting with the Department of Justice on this yesterday. A number of off-site self-isolation centres throughout the state. City West has been used for that purpose, though it's not solely for that purpose as well. And the Department of Justice and Equality are working collaboratively with the HSE to implement their public health advice. And the established procedure across all centres where a person is suspected of having the virus or is confirmed as having the virus is that where advised by public health, they're moved to a dedicated off-site self-isolation facility where supports are available for the duration of their period. And I'll revert to the Deputy on her specific other questions in relation to...
We can...
Sorry,
Deputy O'Murrough and Deputy Andrews.
All right. Look, I want to deal with the tragic situation at Jargon House Nursing Home in County Louth, which I've written to the Minister about. Staff in Jargon House have at times been working in nightmare conditions and continue to do their very best to care for the residents, some of whom they see as family, and I want to pay tribute to them. But according to figures that have been shown to me in the last few days, there have been the deaths of 26 people in this nursing home. They are believed to have died from COVID-19. These are mothers, fathers, siblings and grandparents. Unlike other nursing homes that have featured in the media, I haven't seen official figures for the numbers that have died in Jargon. And this is just a feature of the lack of communication that has surrounded this issue, and that has also added to the worry and trauma. It's almost 3 weeks since red flags have been raised in relation to Jargon with me. Families, some of whom have lost loved ones, have come to me and contacted me about their worries. Nursing staff, care assistants and ancillary staff have also come to me. And I want to thank every one of them for having the fortitude and the bravery to speak out. So today I'm looking to speak for them. Operational control of Jargon was taken over by the RCSI Hospital Group on April 17th. In a statement to the media, the RCSI said they would review their involvement at the end of May. But since the start of last week, I have been told by staff at Jargon that there will be no more RCS staff by this coming weekend. I'm already told that senior management and disease control specialists from the RCSI are already gone. I have repeatedly asked the hospital group for clarity on this point, and while they say they remain in control at Jargon, they will not say for how long, and crucially have not outlined when and under what conditions the RCSI will hand back operational control to the owners of the nursing home. I would like the Minister to address this directly.
Staff, residents and families are desperate for answers about the RCSI plans at Jargon, and I hope he will be able to provide information about the future role of the RCSI at this home. I also seek answers as to how the situation in Jargon came about. I have been informed that as early as April 7th, the owners of Jargon were in contact with the HSE. Did they discuss the developing and worsening situation at the home? Is the Minister aware of these contacts? Does he know why it wasn't until 10 days later that the RCSI hospital group took control? And why and by whom was the decision taken? There are growing calls from families and staff for an investigation into what happened at this home. From the time of the...
We're going to have to go to your colleague, Deputy Andrews, because we need time for the Minister.
I have 1 more minute.
Well, you have, but well, if you want to keep talking and get no answer,
no, that's fair enough. What I want to know is, I just want a direct answer in relation to the RCSI and the timeline and what conditions will have to be met before they leave.
Thanks, Ceann Corlin. Thanks, Minister. Just the government has made a lot of big announcements and big commitments over the last few months, and however these announcements and commitments are not being reflected by action on the ground. A case in point, again, is the announcement about testing. We've been told we're going to get 100,000 per week, then we've also told we're going to get 15,000 per day. And of course, this sounds great, but in practice, it's very different on the ground. I was contacted by a person recently who had to wait 22 days to get their test results, and that was after chasing up the hospital to get those results communicated to them. Others are waiting 12, 15 days to get the results. And I suppose testing figures seem very unclear and not very exact. And I'm just wondering how many results per day are communicated to those tested, because it would seem to be, it could be different. And it's probably a better way of measuring how effective testing is. Another big announcement was the state had done a deal with private hospitals. And of course, again, that sounded fantastic. The reality was different. I have been contacted by staff in private hospitals who have said their hospitals were significantly underutilised over the last 7 weeks, 8 weeks. And when you consider that almost 50% of those who have died from the COVID virus were resident in nursing homes, you have to ask yourself why the hospitals have been so underutilised over the last 8 weeks. One son of a nursing home resident contacted me and he asked me, had the government abandoned the nursing homes? And unfortunately, the answer does feel like it's a yes. And so I suppose in that context, will the Minister commit to using all those resources in the private hospital to support nursing homes? And also, just home care workers are not required to wear masks, and it has been mentioned earlier on. And this is a real concern for many people who have vulnerable family members who are getting support. And it's also a concern for the home care workers. A home care worker may have to make up to 30 visits a day. And can the Minister ask why masks are not required for...
Need the time now for the Minister to respond if you want answers.
Yeah, I have 2 more brief points and then you can respond.
Enough,
and is that all right? Yeah. Pieta House do amazing work for mental health, and unfortunately, because of the postponement of the Darkness into Light walk, they are now down funding and need to cut jobs and frontline counselling service. So Pieta House have traditionally provided services where the HSE are weak. In order to ensure that the vital services Pieta offers are maintained and the jobs are protected, can the Minister intervene and work with Pieta to ensure that the vital services that Pieta House offers are maintained and sustained over the next few months and years? And the publication of Refreshed Vision for Change is now absolutely vital in order to develop a cohesive post-COVID-19 response plan for mental health. Will the Minister commit to the establishment of an implementation group for the Refreshed Vision for Change to develop a post-COVID-19 response plan for mental health? Thanks.
Will we stop the clock there for just a second till I explain to people that which I think should be pretty clear? If there are 4 minutes available for a question and an answer, if you consume the whole 4 minutes asking the question, you can't expect to get an answer. Minister, you have 1 minute 22 seconds to answer the 2 questions.
Maybe some people don't want the answers, but I can speak fast, but not that fast. Deputy O'Murray, look, firstly I want to extend my sincere sympathy to the families and friends and indeed staff in Jargon nursing home that you reference. I'll have to liaise with the HSE on the specific question in relation to the RCSI involvement. I know they have been playing a proactive role. You want an assurance that role will continue, and I'll revert to you directly or through the HSE on that in the coming days. To anybody who has any concern about any long-term residential care facility, I would point out that HICWA is there as a regulator. Deputy Andrews, on testing we're delivering, and I don't have time in 50 seconds to tell you in how many ways we are delivering, but there was a table last night from Our World in Data that shows Ireland ranks 4th highest out of 25 EU countries and the UK country in terms of tests completed as a percentage of the overall population, and also rates can be displayed as tests completed per million population. We are ramping up our testing and we're improving our testing turnaround times, but we can constantly do better and we need to do better. Private hospitals are being used. In another question, I'm sure I'll get a chance to talk about the utilisation figures, but we don't move people from their home to make a private hospital busier or anywhere else busy. We take these as clinical decisions, and I wouldn't like to overrule those clinical decisions. On Pieta, I am looking into that, very grateful for the very good work they do. On Vision for Change, I'm kind of in the hands of the Oireachtas on that. We generally don't bring new policy decisions. Deputy Shortall raised this with me last week, and I met mental health reform today on it. We usually let a new government bring the Vision for Change policy. It is ready to go, though, and I have an open mind in terms of what's the best timing to do that, and I'll come back to you directly on the home care workers.
Deputy Frank Feehan, thank you, Minister.
Thank you, Minister. Let me thank you and all your team for the work that you've been doing in very, very difficult circumstances over the last few months. And let me start by expressing my condolences to the family and friends of those who've been lost to this awful disease over the last few months as well. And I just want to say my mother is 92 and she's in a local nursing home, and she happened to be in Sligo General Hospital. And I just want to say, as people who benefited from the system, I want to pay tribute to all the frontline staff, all the stakeholders for their work, their perseverance in very, very difficult time, for their understanding, but also for their professionalism and vocation to this country. And I think that has to go on the record at the Dáil today. We are very, very much indebted, and I hope in future times that we will remember the great service that all these nurses, doctors, Gardaí, everybody who has played such a great role. Also, it's very, very heartening to see all the various organisations that are trying to help out with the frontline staff in, getting funding for all various meals, etc. And just one thing on the way to Dublin, I was listening to the radio today, and it was I really just caught the mood. Daniel O'Donnell and his really kind gesture outside Dunloe Community Hospital yesterday, where he had his outdoor concert. I think it actually encapsulated all that is good that has gone on in the last few months. And you could see from inside the patients and the staff, there was a great feeling. And again, I want to put on record at Dáil, I think this is something that we should really appreciate and thank. And I want to thank Daniel O'Donnell and everybody for the amount of work they're doing. Minister, there are a few questions that I wish to ask, actually. One is that would you agree with the importance of the Irish-based US pharmaceutical companies to the Irish economy? And given the comments of the US President last week, if you believe there's a role which these companies, which have highly skilled Irish workforces, could play in better assisting Ireland in areas such as testing, for example, during the COVID-19 crisis? And also, how can we get out the message much clearer and quicker that people who are sick or worried about their health condition, that they still need to go to the doctors to be assessed? And there is a worrying drop in the number of cancer referrals, for example. As we know, all cancer has not gone away, and is there a new approach to achieve this? And I know myself, anecdotal evidence from GPs, I think 25% now of people are turning up at the practices. Maybe at one stage it was far, far too high. I don't know, but it is worrying that not so many are going because of this COVID crisis. I've also had, with regard, and it was mentioned here, regard to public hospitals by the state, can you outline to the House when private patients will be able to get private procedures by private doctors and consultants? And I understand what needed to be done, but there seems to be people are looking for maybe a time scale of when this will occur. Also, there is an issue, and we all have everybody ringing us up with over the last 2 months with procurement of PPE. you know, who do we talk to in the HSC? And I understand there is a website, or is an email address that we all can send it, because, you know, even today I've had people from Canada, for people from China, from India and the whole lot, and we want to go through the right channels, and that's so is there an email that we can send on? And I do know the email address, but I think it's no harm that everybody around the country can send it in, because we don't want conflicts of interest when people are asking you, and it's great to have an email address or a website address you can send it on, and there'll be no harm to highlight that again. Also, there is an issue regarding capital help projects under construction. When did it commence on site, and will there be any consequence of projects not yet started but identified under Project 2040 plan? And I'm just wondering, do you have any comments on that? Because with the hit to the economy with COVID-19, it could be an issue. Just one issue, and it's coming up now and again, are dental practices. They have been suspended by NIFET, and they maintain an emergency dental services, and they're providing advice over the phone and arranging prescriptions with local pharmacy. But it has collapsed, the whole practice has collapsed to nearly 5% of normal. And, you know, there's a phased routine to dental care will start from May the 18th. But there is an issue with them, with their practices getting PPE. The cost has skyrocketed, and they seem to be in competition with other agencies and organisations. And it seems it's very difficult to source, and dental teams are going to need an awful lot of PPE in post-pandemic world. And I just want to know, what exactly are the HSC doing, or is there any arrangements with the dentists, because it seems to be an issue. And as I said, they get no support or subsidies from the state, and their sole income is private practice on a fee per item basis. And something that I wasn't fully aware of, but their situation is quite different from arrangements with medical GPs. Dentists seem to say they get no PPE, no financial support, and very little guidance from the government. And I'm sure there is guidance, but I just maybe you could talk about that. And they seem to be I think we need the HSC to sit down with the Irish Dental Association to talk about new contracts, post-dental care, and seemingly from what they say, it's long overdue. And Minister, I look for your views on those. Thank you.
Thank you, Deputy Minister.
Well, thanks to Deputy Fian. I'm actually going to meet the Irish Dental Association tomorrow. I'm scheduled to meet them tomorrow afternoon. There has obviously, as you say, been guidance provided. We obviously have to follow public health advice, but we want to have a conversation with them, just like we do with other sectors, in terms of how they operate in the new normal and at the appropriate time. So I won't preempt that meeting tomorrow, but my officials and myself will meet with them tomorrow. In relation to capital projects, I suppose we'll be guided in relation to our construction projects the same way I suppose the rest of the construction sector will be by NEFIT. But certainly I have no plans to alter or pull back capital projects that are underway. They'll recommence at the appropriate time from a public health safety point of view. In relation to PPE, you're entirely right, Deputy Fian. The fact that this virus is going to be with us for longer than perhaps many people would have expected, we need to continue to seek more PPE. We're doing relatively well in that regard compared to others, but you can never have enough of this stuff, quite frankly. And the website gov.ie/COVID supplies is the best way for people to submit their application and have it assessed, and that's a whole of government effort as well. In relation to private patients in private hospitals, we have obviously issued guidance to the HSE about the obligation to continuity of care. So if you're a doctor and you're seeing a patient, there is an obligation to continuity of care, and if that can't be provided for that patient to be transferred, and I'll send you a note in relation to that. On the issue of non-COVID care, I think you're entirely correct, and I was talking to Deputy Donnelly and Deputy Butler about this in earlier exchanges. We are finalising our non-COVID care plan, and we're starting a major public awareness campaign. You'll have seen some of it today. It'll ramp up again next week, particularly around cancer care. And very much getting out the message. Your GP wants to hear from you if you're sick. Please don't ignore a symptom. Please don't delay in contacting them. And that there is capacity in the Irish Health Service and a safe way of looking after people who are sick from things that are not COVID, as well as looking after those who have COVID. In relation to the issue of pharma companies, look, all I'd say is the relationship that this country has, a long and proud relationship in economic ties and social ties with the United States, is a two-way street and a two-way relationship. There's many Irish companies creating jobs in the United States. There's many excellent United States multinationals here creating jobs here, and we are engaging with all all of industry here, including multinationals, through the IDA and Enterprise Ireland, in terms of the role they might be able to play in terms of providing vital equipment and also making sure Ireland is a location for research as we continue to work our way through this pandemic. In relation to nursing home staff, I want to take the opportunity you've given me to pay tribute to those working in our nursing home staff. You know, I do need to say this, just because there's an outbreak in your nursing home is not a sign of failure on your part. And there's many incredible people working night and day in our nursing homes. There's many nursing homes that have an outbreak of COVID-19, just like your family home might, and they're dealing with it really well. So I do want to say that they're working in very difficult circumstances with vulnerable people, and many of them are doing extraordinarily good work, both public and private. I'm sure when this pandemic is over, there'll be many lessons to learn, and I'm sure this Oireachtas will seek with us to learn them. But I do think when anybody objectively looks at what we're doing in relation to our nursing home sector and compares it to many other countries, I think Ireland has been quite proactive in this regard. Providing personal protective equipment to private nursing homes is not the norm in many other countries. Redeploying staff from the public health service to private nursing homes is not the norm in many other countries. Reaching an agreement with home care workers, where we now have 145 home care workers going into work in long-term residential care settings, and I thank them for that. Testing asymptomatic residents and staff right across our nursing home sector, not the norm. Not sure there's many other countries doing that at all. And putting in place a financial assistance scheme where we now have €4 million ready to pay out to private nursing homes, and we have, I think so far, 277 applications processed to date. So we have put a lot of supports in place, and we'll continue to support the sector.
Now, Deputy Brian Ledden, please.
Good, Ceann Comhairle. Ceann Comhairle, I'll require 5 minutes, so there'll be plenty of time for the Minister to reply, but if I may have an opportunity to revert pending the Minister's answers. Thank you. Firstly, may I offer my condolences to all those who have been bereaved by the COVID-19 pandemic so far, and I share my sympathies with, as those across the House have expressed theirs. Minister, I'd like to revisit my colleague Deputy Smith's, and I'm sure your favourite topic, the COVID Tracker app. First, I thank the Minister for the publication of last week's document. Although it is not a technical specification that an engineer would recognise or use, it did provide helpful and confidence-building information. We were pleased to note that Ireland will, in line with best international practice, be using the Apple-Google framework for decentralised exposure notification. We look forward to seeing the full data protection impact assessment in due course and to engaging in the pre-launch discussion in the House, which the Minister promised. We continue to call for an actual set of technical specifications, ideally including source code, which I think you indicated would be published. Minister, I'd like to focus my questions today on how the app relates to Northern Ireland. By way of background, we obviously have particular concerns about cross-border traffic and potential infection or exposure. Although it is too early to identify causes, the abnormally high excess mortality rates in counties Cavan and Monaghan underline the severity of the problem. As your report notes, international interoperability of contact tracing apps is desirable but complex and will likely take many months to achieve. This is too long for us given our unique border situation. I note that the UK government is almost uniquely in the